Access to Mental Health Services for Young Adults Ages 18 to 39 by Kellen Edwards, Abigail Henderson, Sarah Alarcon, and Carmen Blair. The leading causes of death in Randolph County are cancer, diseases of the heart, chronic lower respiratory disease, cerebrovascular disease, and unintentional disease. Suicide rate is 15.9% per 100,000, and it is the third leading cause of death for ages 20 to 39. Homicide is the fifth. Here is the selected identified health priorities. Community health behaviors include overweight and obesity, diabetes, heart disease or heart attack, stroke, and teen pregnancy. Unhealthy behaviors include drug abuse, alcohol abuse, lack of exercise, poor eating habits, and tobacco use. Community issues include employment opportunities, drug use, affordable housing, availability of positive teen activities, and crime. And human service issues include health insurance coverage, mental health, dental health, Medicaid or Medicare, and routine health care. Highlights from the citizen survey include health issues being obesity, diabetes, heart disease, strokes, teenage pregnancy, cancer, and mental health. Unhealthy behaviors included alcohol abuse, lack of exercise, tobacco use, unsafe sex, reckless or drunk driving, violence, lack of seatbelt use, and suicide. And community issues were identified as employment opportunities, drug abuse, affordable housing, positive teen activities, crime, quality education, domestic violence, and gang activity. This chart is a breakdown of the demographic data based on the U.S. Census Bureau of 2009 to 2013 and Access NC for 2014. In 2014, the median age was 41 years old. The total population was 143,359 people. The income per capita was $20,869. 25,316 people fell below the poverty income level. Unemployment rate was 6.3%, equaling roughly 4,166 people. 80.98% of the population are Caucasian, with the second being 11.1% of Hispanic or Latino people, and African Americans make up 6.3%. 10.6% of the population spoke a language other than English. Manufacturing yields the most jobs at 15,589. Utility work yielded the highest weekly wage of $1,431. In 2014, the average home value was $119,400. The health department data identified health priorities, with these being nutrition, physical activity, reducing substance abuse, and access to care. This chart shows a breakdown of the leading causes of death based on age range categories. For ages 0 to 19 years, the leading cause of death was conditions originating in the prenatal period. In ages 20 to 39, the leading cause of death was unintentional injuries. Ages 40 to 84, including two age ranges, the leading cause of death was cancer, and people 85 and older, leading causes of death was diseases of the heart. Trends and key health indicators. The total cancer deaths per 100,000 was 183. This is 1.4% lower than the state average. Total diabetes death rates per 100,000 was 23. This is 1.8% higher than the state average. Unintentional motor vehicle injury per 100,000 was 19, which is 26% lower than the state average. Unintentional injury death rate per 100,000 was 33. This is 14% higher than the state average. The homicide rate in Randolph County per 100,000 is 5. This is 29% lower than the state average. Suicide rates per 100,000 was 17. This is 35% higher than North Carolina's state average. Mental health services in Randolph County includes Daymark Recovery Services in Asheboro and High Point. This facility offers substance abuse outpatient treatment, mental health outpatient treatment, psychiatric services, intensive in-home services, and DWI, DWLR services. Randolph County is at the very center of North Carolina, and Asheboro is at the very center of the county. Adjacent counties include Guilford, Alamance, Chatham, Moore, and Davidson. Randolph County has a population of 141,752 people, and there are 61,041 households in Randolph County. Over half of these are in rural areas. Most are older homes, especially in the downtown area, and conditions of these homes vary greatly. Only 2 of Randolph County's towns offer Section 8 housing. Rural and urban areas. Southern Randolph County has several potters. The town of Seagrove is known nationwide for its artistry. To the north, we have North Carolina's Zoo and the rolling hills of the Uwharrie. Throughout the county, there are many abandoned or repurposed mills and a lot of farming land. Randolph County is number 1 in the state for broiler production, and this is raising chickens for their meat. Unique to Randolph County, we have in the town of Randleman the Petty Enterprise Historic Site, where NASCAR championship drivers originated. In the town of Trinity, we have the Harley-Davidson Museum, as well as one of the U.S.'s top 10 haunted attractions, and that is Spooky Woods, the Kersey Valley Spooky Woods haunted walkthrough. Transportation and social services. Most social services are in Asheboro, and this includes the Family Crisis Center, the Mental Health Center, Senior Adult Association, and the Smart Start Partnership for Children. There is no public transportation in Randolph County for those who live outside city limits. However, if you do qualify, we do have the Randolph Coordinated Agency Transportation System. Consumer goods. Grocery stores and the like are very easily accessible even in the smaller cities of Randolph County. We do have a very small number of dry cities in Randolph County. This means that you cannot buy alcohol. Seagrove is one of these. There are a few abandoned homes, but in the northern part of the county there is new development going on. Churches are also very prevalent throughout Randolph County, most of them being Baptist, Methodist, or Presbyterian. As far as local business goes, the top employers for Randolph County include United Furniture Industry, Technomark, Randolph Hospital, and Klausner Furniture Industries. The identified health risks of the Windshield Survey include obesity based on several fast food restaurants and visual observance of its citizens, tobacco use also based on visual observance in cars and in parking lots, and young adult behavioral risk factors based on the fact that many of young adults make up those being seen using tobacco, and they are observed loitering, and they make up most of those with jobs of minimum wage. For our key stockholder interview, we interviewed Mrs. Penny Stewart. She is a school nurse for the Randolph County Elementary Schools. We asked her how she would rate the health and quality of life in Randolph County, and she said overall it's fair to good. There is a big disparity in incomes from the poorest of the poor to the very wealthy. We asked her what barriers exist to improve health and quality of life, and she said that transportation is a very large issue, and that education about the need for consistent dental and medical care is another. We asked her if public transportation available to help with access to care, or is the access to care issue greater than just the transportation piece? And she stated that there's no public transportation, which is a big issue in such a large county. Many resources, such as the health department, are located in Asheboro. Most people that need help cannot afford it. Few, if any, resources for the indigent for medical care. No free health clinics or dental clinics. And if you don't have insurance or transportation, you can't get the care that you need. We asked her what were the top 5 critical health and quality of life issues in Randolph County based on her opinion, for ages 18 to 50, and she stated lack of public transportation, lack of knowledge of available resources, lack of nutrition education, lack of exercise and safe free exercise, both of these leading to obesity, and lack of mental health care facilities for all ages. We asked her what actions, policy, or funding priorities she would support because they would contribute to a healthier Randolph County, and she stated a bus system to Asheboro and monthly free dental and medical clinics. We asked her what else could be done to improve the health and quality of life in Randolph County, and she stated physicians taking time to talk with their patients about lifestyle choices instead of having to fulfill insurance required patient caseloads per day. We asked if there were any mental health facilities in Randolph County and where was the closest and if it was a big or a small facility. She stated that the mental health facility is overworked in this area. Daymark is in Archdale. It's close, but it's very small. And there is a stigma against mental health that keeps many young adults from seeking the care that they need. Our composite data analysis, the strengths of Randolph County include public education, which is the highest employer in the county, economic assets, which are the zoo, the Seagrove Pottery, and the NASCAR Museum, and local hospital and Daymark Recovery Services. The hospital is the county's third largest employer, participant with the health department and community needs assessment, and the mental health facility is located. We do have a mental health facility located in Randolph County. The county's weaknesses are obesity and physical activity, drug abuse, alcohol abuse, suicide, homicide, and unintentional injuries, mental health, because we only have one facility in Randolph County, and access to health care based on transportation or lack of insurance. Our chosen community health diagnosis is community health patterns related to mental health services for young adults ages 18 to 39. Potential and actual problems are substance abuse, suicide, and only one mental health facility. The areas affected by the problems are drug abuse, alcohol abuse, suicide, homicide, crime rates, and depression. The level of community awareness of identified problems is a survey conducted shows that community concern for drug abuse and substance abuse. 50% of residents agree that mental health is a problem. Of the 20 health problems chosen by Randolph County, mental health was number 7. And mental health is underreported because it holds a stigma. Interventions. Social activities to prevent depression, crisis centers and crisis hotlines, involvement in legislation and policy promotion for mental health reform, funding for additional mental health services in Randolph County, support for medical staff, establishing trust, talking to patients about problems so that they can be addressed and helped correctly, county or city-specific transportation system to help people be able to access care, and addressing the stigma related to mental health and education systems and health offices to prevent people from not seeking help. And that is the conclusion of our presentation. I hope you enjoyed it. Thank you.